One of the purposes of psychology is to differentiate between the sane and insane. The way this is done is through the diagnoser's interpretation of 6 categories. The 6 categories are context of the behavior, persistence of behavior, social deviance, subjective distress, psychological handicap, effect on functioning. For example, if a person's behavior is way too extreme for society's norm, that falls under the category of behavior defiance and is a strike against them in the insane category. One man, David Rosenhan, decided to challenge psychology and their diagnosing procedures. Rosenhan felt that psychologists could not accurately identify the sane from the insane. Mr. Rosenhan also wanted to figure out whether mental illness is something that comes from inside the brain or the situation that the diagnoser observes the patient in. Rosenhan's experiment consisted of him sending 8 pseudo-patients, including himself, to try and gain acceptance to 12 different mental institutions scattered on the East and West Coast. There were 3 psychologists, 1 pediatrician, 1 psychiatrist, 1 painter, and 1 homemaker. Gender-wise, there were 5 males and 3 females. Upon admittance, each patient claimed to hear voices. They said that the voice, although mainly muddled, was clear when it said the words empty, hollow, and thud. 7 of the patients were diagnosed with schizophrenia, and 1 was diagnosed with manic depression. As soon as they were admitted, each pseudo-patient began acting normal. Sadly, none of the doctors or nurses could see the normality of how they were acting. Most of them would only stop to talk for a couple seconds at the least. The funny thing is that admitted patients could tell that the pseudo-patients were faking, but alas, the doctors and nurses wouldn't listen to them. The average number of days that the pseudo-patients stayed in the institution was 19. Each was released with the title Schizophrenia in Remission. The reason Rosenhan said that they got this title and weren't listened to is because when people are put in these institutions, the workers there only see them as crazy. Another man, Spitzer, made an argument against Rosenhan's case. Because diagnosis and admittance is based on verbal accounts, anyone could sneak their way into a mental institution. But why would they want to? Another case, inspired by Rosenhan, was the case of a proclaimed mentally ill man. A man was convicted of sexually abusing a young boy, and before he went to trial, he was psychologically analyzed. The psychologist found that the man was mentally ill, and because of that, he wouldn't receive the death penalty and would be sent to a hospital. Later on, they learned that the man had faked his symptoms. We must learn from this that mental illness can have some advantages, and we must monitor and be sure of the diagnosis.